Hey everybody, we are going to pick back up where we left off. Let me kind of get everything lined out here and get my presentation or my presenter open. So we're going to pick back up and we're going to start off by watching. We talked yesterday, you watched the male catheterization. Remember that these catheterizations in these labs, some of the labs that you watch them collect will not be on live humans. Some of them will be. When we do the rapid strep and those kind of things, there will be videos that you watch that are played that that will be on a human. But for catheterization, I think it's important that we watch it on a mannequin. So we're going to watch how to catheterize a adult female now, and then we will move on to the next test, our lab test. And as that's pulling up, you guys know I drink a lot of Coke Zero. Okay, here we go.
I would review my orders. I would obtain my supplies. I would then introduce myself. I would wash my hands, and then I would identify my patient in two ways.
We let that try to get that bigger.
In order to do a female straight cath, I would review my orders. I would obtain my supplies. I would then introduce myself. I would wash my hands, and then I would identify my patient in two ways. I would go through, I would assess the patient, explain the procedure, answer any questions.
And I apologize, guys. I know this is not very loud. It is as loud as I can get it on both of my volumes, as you can see. But it is a very good video. So you may have to click the link yourself, put in your headphones, and watch it again.
I would review their allergies, make sure they're not allergic to latex or shellfish. I would provide privacy, make sure I have adequate lighting. I would then raise the bed for proper bed. Prep my patient. I'd put the patient in a dorsal recumbent position. I'd give assistance if needed. Then I would organize my work area. And I would don my non-sterile gloves. I'd have already exposed just the peri area, making sure to cover everything else. And then I would get my stuff for peri-care. I would wrap my washcloth. I would go down each side and then down the middle, making sure to use a different side of my washcloth every time. Then I would remove my gloves appropriately, and I would wash my hands. So to do my procedure, I would open my cath kit. I'd carefully grab my sterile gloves. I would don my sterile gloves.
Now, I'm going to tell you right here, she's making an error. So that's one of the things that as you learn to do this and you get so good at it, you remember or you notice things that they're doing wrong. One of the things that she is doing wrong is she's opened her cath tray, but she's not opened her catheter. She should have opened her cath tray, taken the gloves out, and then opened the in and out cath or the straight cath or the rubber silicone, whichever cath she has, and put that into the into her sterile field. Or opened, as the previous gentleman, he did a perfect job on the male. Used the glove, changed gloves, good clean hands after she did peri-care, and then went ahead and gotten her sterile field ready so that when she put on her sterile gloves, she's not touching anything non-sterile. You do not want to, once you put on those gloves, the sterile gloves, you should be ready to basically have everything set out and you're good to go. And so once again, she's made an error here by putting those sterile gloves on before she has put the Foley catheter and put that on her tray. And I apologize, our internet is running slower than usual today. Her gloves are being put on appropriately. And the reason why I chose this video as opposed to others is simply because this particular video, she has opened that catheter but hasn't dropped it. But I have done that. I've chosen this one simply because it was one of the few that actually used a good mannequin where you could see well.
I take one fenestrated drape and turn the shiny side down. I use that to make a sterile field. I take my second fenestrated drape, shiny side down, and I would ask for assistance or have the patient help me, but place it slightly under the patient's buttocks. I take my last fenestrated drape, make sure that the shiny side is also down, and place it just over the peri area. I would then take out my urine cup. I would sterilize the vagina, going down each side. Using a different swab each time. And then going straight down the middle of my last. I would then have my assistant grab the catheter, open it for me, and then I would lube the catheter 1 to 2 inches with my non-dominant hand. I would open the labia. I would instruct the patient to bear down. I would insert the cath 1 to 2 inches until I got urine. And then I would continue and insert another 1 to 2 after that. If the catheter didn't go in the urethra the first time it went to the vagina, I would start over and get a new cath kit. Once I have 20-30 cc's in my sterile specimen cup, I'd pinch it off. And then I would empty the rest of the urine into the container until urine has ceased. Once the urine has ceased, I would instruct the patient to relax, and then I would carefully and slowly remove the catheter.
Okay, I want you to hang on 1 second because I want to talk about something real. Okay, one of the things I want to talk about, and then we'll get back to this video, is I did in the beginning, is the importance of peri-care prior to female catheterization. So peri-care is basically taking a mild soap, water, and a wash rag and cleaning from the creases of the pelvis in, but wiping down, folding the wash rag again, wiping down the other side, just like she provided the use the iodine to clean the vagina. You do the same thing with peri-care, and the reason why you do that is because it's very important to get as much normal flora, which is your normal skin bacteria, any loose skin cells, things like that, to get those away before you actually swab and get ready to perform the in and out cath. You actually insert a Foley catheter, a catheter that's indwelling, that stays in the bladder. You use the same procedure, minus the fact that it's attached to a large bag that would collect the urine. You would use the same procedure. Now let's finish watching like I said, I just wanted to take that a moment to remind you or to discuss why that she talked about doing peri-care prior to performing that in and out cath. And also it's important to be sure that you clean your patient afterwards. Male, female, doesn't matter. You want to be sure you clean that iodine, Providine off. If they're allergic to shellfish or iodine, there are alternatives. Chlorhexamine, there's a couple of other alternatives to clean the peri area to do that particular, or they're latex sensitive, anything like that. There are alternative kits to utilize to do that in and out cast so that you do not make them have a reaction.
I would then close my specimen cup, label it.
Once again, I apologize. Our internet's a little slow.
Then I would get a biohazard bag. Put my orders in the front and send it to the lab. I would then remove some of the drapes and the catheter. And discard them appropriately. I would measure and then discard the rest of the urine appropriately. I would then provide pericare again after I remove my gloves, wash them, and then don non-sterile gloves. I would provide pericare, making sure to change the side of the washcloth each time, dry the peri area. I would then finish removing the drapes, get assistance if I needed to, discard appropriately. I would then lower the bed, put the patient back in a position of comfort and safety. I would wash my hands again, and I would provide privacy and get her back to comfort. And then if she wanted her family back in, I would do that, and then I would go document how much the output was.
Another thing to remember when we actually do labs is we always want to be sure that we document how much urine that was collected in the specimen cup, as well as how much we drained from the bladder and disposed of. She said you would have your order. You're going to print your order before you go in. If you're not just doing... If you're sending it out for a culture, you're going to put it in that bio bag. Now, in a doctor's office, you're going to take that specimen cup along with the order that's been put in the back, and you're going to put that in the refrigerator. If the urine were to sit out all day, bacteria would continue to grow. If there were bacteria, normal flora would grow. Any kind of contaminant in there might grow, and it would not be a viable, or it would not be a specimen you could use, and you would have to recollect it. You don't want to have to recollect specimens from patients when you have to do something invasive, or they have to come back in from work. When you're doing a lab on a patient for any reason whatsoever, if there's any way you can prevent the patient from having to come back because of human error in collection or storage, you want to do that. Patients get very, very upset. And a lot of facilities, if you use the wrong needle, if you use the wrong technique, if a patient has to come back in for a reason that's staff error, sometimes that's a write-up. Sometimes that gets you called into to the provider's office, or get you called into the supervisor's office. So just be sure, if you don't know how to do this or you've never done it before, have someone with you. Watch someone before you do it. You know, those of us who are really old nurses, we had an adage that all of my instructors always would say is, see one, do one, teach one. Because we would watch someone do one, then we would have someone watch us complete a skill, and then we would teach someone how to do that skill. Once you had done it enough that you felt comfortable enough to teach a skill, that means you know how to do it top to bottom, just like this young lady. Like I said, she did a little bit of different technique than I would have done, because she said, have your assistant hand you the catheter. Well, many times you don't have an assistant, especially in a clinic setting. You don't have an assistant. There's no one there to help you. So you would have already put that catheter, like the gentleman did, into the sterile area or the sterile field, because there's no one there to help you. So that's kind of one of the different things that she discussed. Now, in a hospital setting, you may have assistants, because you may need to have someone help you hold legs, position the body, position the person's body, pull them up in bed, all those kind of things. So you may have help in a hospital setting, but in a clinic, you're not. All right, so let's keep rolling. Stool specimen collection. Now, we are going to watch a video, and I will add that to this, and I'm sorry that I have not done that. But, excuse me, stool specimen collection can be done for many different things. They may be checking for C. diff, which I didn't put on here. That's Clostridium difficile. If someone were to have C. diff, it would mean they had severe diarrhea. That's something that you can, it's explosive severe diarrhea. People get that from antibiotic therapy, where it kills off all the good bacteria in the system. Sometimes people get it from chemo. It can be they can get it from someone else. But you want to be sure that that you know what is being ordered. O&P, which is for parasites. A smear where they're going to just look at the contents and for blood, white blood cell count. Any of those kind of orders. You want to be sure that you look at your reference lab manual to make sure that you're getting the correct amount. So like for an occult blood stool, you're only going to need a very small amount of stool. For a O&P and a WBC, if you're sending those out together, you basically need a whole urine specimen cup, the sterile specimen cup. You need one full of poop. Or stool. So you need to be sure that you have looked at your reference manual so that when you give that stool collection specimen to the family member or to the patient, because sometimes we have to do this on kids, like say they had Giardia and we needed to check for that parasite, ovum or parasite, we want to be sure that everyone understands the amount of stool that's needed. Like for an infant, we can just swab a diarrhea diaper and send that off for C. diff. But if we need O&P or for WBCs or just for a smear, that much, like I said, we need a whole cup of stool. So you have to read your information. When we're doing a fecal occult blood specimen, we want to be sure that there's two ways that most providers do them. You generally do them times 3. If we're checking something in the office immediately where we have the little white card and we can do that, put the drops on it, let it sit and look. Sometimes they'll do it times 1, and if it's positive for blood, they'll send it home with the patient and ask them to do 2 more. Sometimes we just send a packet home to with a patient, and we need to be able to explain what our packet tells the patient to do. And then they take that home, they collect their stool, and they actually mail that back into a reference lab. Now, like I said, depending on your facility, you need to know what is expected. If we're going to do emesis, occult emesis, which means checking vomit for blood. Now we can use the GUAC or the GUAC card that you just put. There'll be 2 or 3 little windows depending on the company, and you put a small amount with a Q-tip or cotton swab. You take and put some of the emesis on there. You put some of the reagent on it. You let it sit for a certain amount of time, 30 seconds, 1 minute, up to 3 minutes, some or 2 or 3 minutes. You let it sit. You open it up, and it will give you a reading based on how they. Sometimes it just changes colors. Sometimes it'll have a window below the little the slots that will give you a positive or negative reading. It just depends on the companies. Like I said, there are multiple different manufacturers that make these types of specimen collection. Specimen collection test. You just have to be sure you know what your facility uses and you follow those manufacturer and industry standards, which means make sure you're using gloves, make sure you're not leaving it sitting out too long, that you're handling it appropriately, that you're not being careless with what you're doing. So let's take a minute and let's watch the collection. Some directions on stool collection, and I'm sorry, like I said, so usually the one that I like to use pops up first, but you never know about YouTube. There's something new every time. Okay. This should be the right one. It's very quick.
Okay, so we'll go over the different types of stool specimen collection. So our patient had a bowel movement into the hat in the commode chair. So some of the common things that you send stool for in facilities are, of course, C. diff. So this actually does sort of have the look of C. diff. It's very watery and loose.
That's not real stool.
Won't test a specimen for C. diff if it's formed, so it has to actually be quite watery. So for C. diff, the containers that you use depends on the site, but you can look it up if you're ever unsure on the Microbiome website. But they'll accept it in the orange sterile, often kind of known as the urine collection container, or also this fecal collection container that has sort of like a little spoon inside of it. And so how you transfer it kind of depends on where it's being transferred from. So in this case, I would probably just attempt to pour it out this sort of spigot into the container. What you can also do if the stool is a little bit more softer formed, maybe it's for a different test, is actually use a tongue depressor.
Okay, so one more thing I want to tell you guys. The white container that stool is in, that is when I refer to a speci hat or a specimen hat. That is a specimen hat. And you can actually put one direction facing the front of the toilet to collect urine, and then you can overlap the little lip at the back of it, and you can put one at the back to collect stool. So it can actually cover a bedside commode, or it can cover a toilet, so that both specimens could be collected if needed.
Or a disposable plastic spoon to transfer it into the container. Other types of tests that you may see stool being sent for or done are occult blood, so kind of like a hidden blood. If they're suspecting that, that's typically done for, say, colon cancer screening. Sometimes you'll even see it sent on those envelopes where you sort of apply it to a special type of paper and then close it up and you seal it and send it that way. Another type of stool test that we send is for ova and parasites. So if they believe that you have some sort of parasite, that's testing for those parasites, and then ova is the eggs of that parasite. So that stool sample can again be transferred using, say, a tongue depressor that gets thrown out, etc. And it gets transferred to a different type of container that has an SAF solution in it that's just helpful to the lab. So you just, again, can look that up on the Microbiome site if you forget which container to use. But those are kind of the main tests that stool is sent for in facilities. So just make sure with your stool specimens, no matter what you're sending it for, that you label the container with the patient's name, hospital number, etc. Generally, we will addressograph a sticker or label, and then also you want to make sure that same information is on the requisition, and that it's the correct requisition, and that you're checking off what you would like. So generally, you'll see that gastrointestinal tract specimen, and then you'll check off what exactly you're testing for, or sending the stool for, rather.
Okay, now I want to let you see how to oops. Okay, we're going to do this one from the micro. It already has the stool collected. You do emesis the same way, but the emesis would be collected in a basin.
Today we're going to be doing the fecal occult blood test, and that is looking for blood in the feces. It is a screening test. It's not extremely accurate, so places may not actually do this anymore. There may be some doctor's offices that still do it, so that's why we're doing it in class. What you're looking for is the possibility of red or brown blood in the feces. So you may not actually be able to see it like you can in this blood specimen, or this fecal specimen that I have right here. I actually poured blood in it so that it was very obvious. But you may have blood in the feces due to many reasons. It could be.
So normally when there's blood in the stool, you will not see it that prevalent if you do. I mean, that's obvious that there's blood there. But this will show them how to use the developer, show you how to use the developer where it is, you can see how the reagent shows up correctly. Also, like she said, it's not super accurate, but I guarantee, it's used as a screening. That way we can tell if we need to send someone on for further testing, or if we need to send them to a GI doctor, or our provider would need to send them to a GI doctor.
Colon cancer, it could be an infection by H. pylori. It could be anal fissures, which means that every time that a person poops, there may be a tearing in their anal skin, and that could cause blood in the feces. It could also be contaminated by a woman's menstrual period blood. So there are a lot of different reasons why there may be blood in the feces, and that's why the clinician has to use the patient's health history, to figure out what exactly is going on, and why this is not.
Also, there is the Hemoccult. There's one. This one is specifically for fecal, but there's also one specifically for emesis. They look very similar. The emesis one, the last set that I used had a blue line and a darker blue strip around the bottom, and it says, instead of, this one says do not use for gastric specimen. That one says do not use for stool specimen. So
extremely accurate. So first, we have to get our specimen. There are sticks in the kit. You can also use a pipette if you wish. A lot of times, the poo is going to be very liquidy or semi-solid, one of those two, because if you are doing this, there is going to be some kind of gastrointestinal distress, unless, again, we have a problem with anal fissures, which may not include gastrointestinal distress. This should be done in a hood. I'm scared that if I do this in the hood, that it will cause a problem with the mic. So I'm just going to do this in front of you here. Always wear your safety gear. And again,
and the reason why they say over a hood is due to smell, especially if there's a gastric bleed. The smell is very, very, very specific and very strong.
I dumped blood in this, so this should definitely be positive. All right, so I put the feces on here. There are instructions on how to do this actually on the card as well. So what you're going to do is you put the fecal specimen in the two windows. You're going to close it up. There's a little tab that opens here. You put the top of it in there so that it's nice and closed. Then we are going to wait 3 to 5 minutes. And when it is done, we're going to develop the test using the kit's developer. Okay, so there is a set of QC that is in the card itself. So as soon as we open it, there's going to be a positive and negative QC window. We're going to put 2 drops of the developer in between those QC windows. And we're also going to do 2 drops in between the fecal windows. Okay? So say that it's 3 to 5 minutes already completed. We open it up. Looks like a face. It's kind of funny. We always swirl the reagent, and then we're going to do 2 drops. 1, 2 in between the QC. Positive indicates, blue indicates positive. No color change indicates negative. So I'm going to do 2 on each window. 1, 2. And that's the test. This one is actually bubbling. And yours may not do that. It's just overly run with blood. All right, that's it.
Okay, like I said, that's a fairly simple test that is often done in the doctor's office. So just so that you're aware that does get done. Okay. And I will add those websites so that you can watch that once again if needed. All right, so sputum collection. Now, sputum collection is one of my least favorite things. I don't mind stool. I don't mind urine. I don't mind vomit or emesis. I don't mind most body fluids, blood, wounds. None of that bothers me. I am not a fan of sputum, though. Sputum is mucus from the respiratory tract. And it's generally sent out for culture, for gram stain, for WBC, to check for white blood cells, different things like that, so that we can tell kind of what's going on. Sometimes, and there's a really specific procedure you're going to check with your, and this is going to be a send out. So sputum collection, we're going to collect it, but we're going to send it out. So you want to be sure that you read from your reference manual for whichever lab that you are sending it out to, whether it's Quest, DRL, or LabCorp. You want to be sure that you collect it in the correct specimen container they want. Just like with the stool, the lady in there was showing you one from a hospital setting. But when you're collecting stool, you want to make sure that you have the correct specimens. And you can order your specimen. You'll order your specimens from whichever company. They send those to you. They don't charge you for those. Like LabCorp, DRL, Quest, they don't charge you for specimens. Containers, whether it's blood tubes, blood culture tubes, if it is urine collection, stool collection, sputum collection, if it's wound culture tubes, they don't charge you for those. They mail those to you. So when you get to a certain point, or you may not keep a ton of them. If you know you're going to be doing a 24-hour urine, you want to keep at least a couple of those containers all the time. When you give the last one out, you want to order some more. Or you want to try to keep one spare set there all the time for the larger containers. You want to probably keep 3 to 5 of the others. The Hemoccult stools, now those usually have to be those generally don't come from LabCorp, Quest, or wherever. You're going to have to order those from one of your distributor companies that you order things like EKG paper, things like that. You would order that from there. So let's talk a little bit about this. And then I want to go over one more time and just remind you, when you label a container, all of the things that need to go on it. So you're going to have a patient swallow really good, and then you're going to have to have them take a deep breath, and you're going to have them cough, and hopefully they will cough up some sputum to go into that container. You want it to have the least amount of spit possible or saliva possible, and to try to get a good solid sputum collection. Now, this is if we're sending it off for that. Later on, we'll talk about nasal swabs and sputum for flu, but right now we're just talking about specifically for a sputum collection. You want to always make sure that your container, all sterile containers will have a little seal on them. You want to make sure your seal's not broken. You want to break the seal, let the patient see you break the seal, give them the cup, let them spit, try to tell them not to get their face on the container or over the container, ask them to kind of hawk it up and spit it into the container. Seal it appropriately. Now, always remember, every specimen that you collect, no matter what it is, whether it's blood, stool, urine, wound culture, whatever it is, you want to be sure that it has the patient's name, their date of birth. If you're sending it out to a reference lab, you'll have a requisition sheet, and I will show you when we get a little closer to the end of this what some of the requisition sheets look like. I'll show you some examples. They'll have stickers at the top. So if you're going to collect, maybe on one patient, you may be collecting urine, sputum, and blood. There'll be a requisition that you can order all of those things on, but you have to be sure that you put one of the reference lab's small little stickers on the container. Plus, you have to put their name, their date of birth. You have to put your initials, the time that it's collected, and you need to put the doctor's name on it. Some reference labs ask for more information. Like if it's a wound culture, you're going to put right leg, left leg, right arm, wherever you collected that culture from. And you for sputum, you want to write sputum. For stool, I always would write stool. Urine's kind of obvious, but you want to be sure that you write that on there. Some specimens need to go into all specimens go into a biohazard container. There's a little pocket at the back for you to put the requisition in, and then you're going to get that, house that however the reference lab tells you. Lots of cultures, wound cultures, do not go in the refrigerator, but if you're collecting a wound culture and blood, most blood has to be collected and put into the refrigerator. Sometimes it has to be spun down. Sometimes it has to be frozen. Sometimes particles have to be removed, like you may spin it down in a purple top, and you for like a BNP, for someone who has congestive heart failure. This is just an example. You may have to spin that down and separate the plasma from the red blood cells. You may have to pull off some of the plasma, put it in a separate container, and freeze them both for them to do that test. So, like I said, you just have to be sure that you know what container and what procedure with your reference lab. Because if you don't do it correctly and they have to come back in or go somewhere else, your patient is not going to be happy, and neither is your provider, because it's prolonged them getting the results that they need. Now let's watch a sputum specimen. We're not going to look at one from a trach. We will look at that next time, but we're going to do regular sputum collection. And hopefully it'll have volume.
To collect a sputum specimen, first provide privacy and identify the patient. Position him in a semi-Fowler's position.
That means you want your patient to be
Then
sitting up
assess
straight.
the patient's respiratory status and anxiety level. Plan to continue assessing these factors during the procedure. To collect a specimen by coughing and expectoration, put on clean gloves and give the specimen container to the patient. Caution him not to touch the inside of it. Then have the patient take 3 or 4 slow, deep breaths. Tell him to exhale slowly and completely to move pulmonary secretions into the larger airways. Make sure you are positioned to the side of the patient to avoid inadvertent aerosolization of sputum when the patient coughs. You may choose to wear a mask for added protection. When he completes these deep breaths, ask him to cough after the next full inhalation. If the patient can cough productively, have him expectorate the sputum into the specimen container. Do not let him clear his throat and spit saliva into it. Repeat the sequence of deep breathing and coughing until you obtain 2 to 10 milliliters of sputum, not saliva.
You need about 4 milliliters of
collect
sputum.
a specimen by suctioning, prepare the suction machine or device, ensuring that it's functioning properly.
Patients don't like this
Then
one.
connect the suction tube to the adapter on the sputum trap. Pour a small amount of sterile saline into a sterile container. This saline will be used to rinse the suction catheter or push the sputum in the catheter into the sputum trap when the specimen obtained is a small amount. Then put on sterile gloves, keeping your dominant hand sterile for the procedure and your non-dominant hand clean. Connect the sterile suction catheter to the sputum trap. Remember to keep the trap upright to avoid inadvertent suctioning of the specimen out of the trap. If appropriate, pre-oxygenate the patient for 1 minute with 100% oxygen. Then lubricate the end of the suction catheter with sterile water. Without applying suction, gently insert the lubricated catheter tip through the patient's nasopharynx or endotracheal tube or tracheostomy, and advance it into the trachea. As the patient coughs, apply suction for 5 to 10 seconds, collecting 2 to 10 milliliters of sputum. Then release the suction, remove the catheter. If sputum remains inside the suction catheter, suction a very small amount of sterile saline to flush the specimen from the catheter into the trap. Now detach the catheter from the sputum trap and turn off the suction. With either collection method, tightly close the specimen container. For a sputum trap, connect its rubber tubing to the plastic adapter and dispose of the catheter properly. Now note the sputum characteristics, including color, consistency, odor, volume, viscosity, and the presence of blood. Offer the patient tissues and dispose of them properly. If any sputum is present on the outside of the container, wash it off with disinfectant. To finish preparing the specimen, securely attach the properly completed identification label to the side of the container. Place the specimen container in a biohazard bag and seal it. Then remove your gloves and place the first bag with the specimen into a second biohazard bag with the completed laboratory requisition. Make sure the specimen is transported to lab or refrigerated immediately. As part of your follow-up care, offer the patient oral hygiene and plan to review the sputum test results when they are ready.
Okay, guys, so you definitely have seen how that works. Okay, so we've had about 40 minutes here. You had a bell ringer earlier. You have some more reading to do. You will have a quiz over the lecture and over your reading on Monday. So be sure that you've completed your reading. You've had about 50 minutes each day to kind of work on that. So be sure you're doing that. If you have any questions between now and Monday, please email me or send me a message on Google Classroom, and I'll do my best to get back to you as quick as possible. Thanks, everybody. Have a good day.